Hey guys, Dr. Alyssa here from Renew Health, and I wanted to go over a rectocele and also some techniques that can be really helpful in mitigating some of the symptoms that come along with a rectocele or a prolapse. Okay, so here we have a picture of what a rectocele actually looks like. So there are different types of pelvic organ prolapses that we can have, and the rectocele is the descent of the rectum into the posterior or back part of the vaginal canal. So in this picture here, what we're seeing is the pubic bone in front. We're seeing the bladder, our uterus, if we have one, and the rectum. Now, we also have our core. So we have our pelvic floor on the bottom here. We have our abdominals, our diaphragm, muscle of breathing, and then the lumbar stabilizer, so our back muscles. And within this cavity, again, we have these organs. Now, if we have pressure that goes downward into the system for lots of reasons, constipation is one of them. If you've had a child, that's also a risk factor for sure. So if there is pressure downward through the system, going down into the pelvic floor, again, sometimes we can have a prolapse of one of these organs. So if we look at the rectal position here, what happens is it starts to kind of protrude into or descend into the vaginal canal. And so what happens is we might get, again, this protrusion of the rectum into the vaginal canal, and we might feel pelvic heaviness. We might see tissue coming out of the vaginal canal. And again, we may have some pressure management issues because of this. Now, one technique that can be really helpful, especially if constipation is the biggest issue that we're working on and trying to deal with, is what's called splinting. So because of this little pocket here that I've drawn in, if there is stool, for example, that is in the rectum, sometimes when we try to have a bowel movement, the stool can get trapped there. And so sometimes it feels like increased pressure or heaviness. And also, if we're trying to have a bowel movement, sometimes we feel like we can't completely empty. Okay, so a really good technique that can be used for, again, symptom management, short-term kind of solution, is what's called splinting. So with our model here, I will demonstrate what it looks like to perform some splinting. Now you can use your hand. We recommend washing your hands first and using, again, a clean thumb or finger to insert into the vaginal canal. So again, the back part or posterior aspect of the pelvic floor where we may have a rectocele is on the bottom here. So if we can imagine a little pocket stuck here, it may be really hard to evacuate stool. So what we recommend is using a squatty potty to poop as well, inserting a thumb vaginally and pushing down. The thumb tends to work the best just based on orientation. If we're doing it to ourselves, being able to just kind of hook the thumb in and give gentle pressure down on the posterior wall of the vaginal canal, or again, the perineal area. This can be really helpful in avoiding straining and also get you to evacuate your stools a little bit better. If you guys have any questions, of course, let us know.